A very good evening to everybody. Welcome to the 48th episode of Eclectica, the Different News. As you are already knowing that we are running a special series inside Eclectica every Friday on dental scientists. So today I'm very glad today to bring up a very fantastic guest today, whom I have been working with now from years together. So she is our scientific head at Croinas, and she is Dr. Rujuta Patil Kulkarni. So before I call her up, I just wanted to tell you about her and what exactly we are going to speak about today. So Dr. Rujuta is a periodontist. If you do not know what is periodontist, she is a gum specialist, and she is a university rank holder, and she has been into this journey of clinical research and evidence-based study right from her post-graduation days. And she is an appropriate guest here. Not just that she is my colleague, but she has an extreme acumen towards understanding oral health science in a bigger perspective, and the kind of skills that she has earned during her education, it is really commendable. So today actually we are going to talk about something which is a buzzword now, or you might have heard here and there in different types of sessions or seminars. But today we are going to crack it down, and we will understand from Dr. Rujuta what exactly is all this about evidence based studies, clinical research. It sounds extremely highfunder.com, but I think we have somebody who can break the ice, and it will be extremely easy to understand. And let's see what more she has in her bag. So, with that, let me call my guest in today, and I'm very proud to host her. She is an asset to our company. Welcome, Rujuta, Dr. Rujuta. Thank you so much for being here today, and it's a pleasure hosting you on Eclectic, and particularly in this dental scientist series. Thank you for accepting my invite and coming on this show.
Thank you so much, ma'am, for inviting and for such a generous introduction. I'm really glad, I'm looking forward to this interview. I have been learning about evidence-based research and practicing it also. But today it'll be the first time I'll be speaking it, or to a greater audience, addressing it to a greater audience. So I'm very much excited. Thank you, ma'am.
That's great. So, Dr. Juta, as you know, that we need to understand this terminology. So, when it comes to evidence-based or evidence-based clinical research, at the point when we are starting our journey into this phase, like you started a few years back when you were a student, so I'm sure that that time this would all look like big mountains. So, my first question would be to you that can you tell us exactly, in a very simple way, what exactly is this evidence based studies, or evidence based, what do we mean by evidence based research for that matter?
So evidence-based research, I know this sounds very complex terminology, but it's quite simple. It's very simple. Evidence-based, evidence in the sense whatever is being, whatever the studies have been done or published, any kind of reports. Those are what we have as our evidences. So, in case of evidence based research, is whenever we are going to perform a new kind of a study, a research study, we just go back, refer. It's like whenever we don't know anything, we go back to our textbooks in our school days. That's what we used to do. Like, I know, okay, I forgot this. I go back to textbook and I answer. Similarly, that whenever I'm doing a new study, I go back. I do a systematic format of a research. Like I try to understand what is there in that, pertaining to whatever I am going to do. I study everything about it, put it in a formative manner, and then I try to analyze if the study which I'm going to do is accurate, valid, or of a public importance or not. So this is nothing but evidence-based research. So simply just coming up, and if we do a research, might not be having that kind of a public impact, and that is what we have to understand.
That's great. I think what you said, brings me to a point. Maybe is it like you are trying to say that, see, it's evidence based, so something that we are actually seeing, but then when we are seeing in a repetitive way, or maybe in, say, like for example, if we talk about patients, since we are clinical people. So if we are, we try to observe a pattern of a particular disease, maybe, or any fact for that matter, and then we try to come to a conclusion in a more systematic way. Maybe that is evidence based study that you are trying to, tell, or maybe if I understood correctly.
Ma'am, exactly, if I have to put it properly, is that I'll give a small example for this. I think
Yeah.
that would make everybody understand this in a better manner.
Mm-hmm.
Now, I want to do a study. It's simple that I want to understand whether periodontitis or a gum disease has an effect on the diabetic level of a person. Diabetes, commonly present disease. Now, I want to do this study. What I'll do, I'll go back, I'll study what is periodontitis. If somebody who doesn't know what periodontitis is, for example, a UG student will be knowing but will not have memorization. So I'll go back, I'll see what different kind of gum disease is, what is diabetes, okay, how diabetes and periodontitis could be related. I'll go, I'll study. Then what I'll do, I'll try to see all kind of research articles, everything that is present, okay, in a systematic manner. There is always a stepwise procedure while performing evidence-based research. Then what I do, I'll come and I'll try to understand where there is an evidence gap. What is exactly needed for a clinical practice? Okay, finding what will be helpful to the patient. Now I'll come back and do this study that will be helpful. So this is evidence-based research. That's all.
Okay, okay. I think it has a motive that, where, as you said in the beginning also, that it should have some impact, like impact on the society, or maybe as you said right now, that how, what exactly I should do so that I can solve the existing gap or existing problem which is not being addressed. So I think
Yes.
it sounds very interesting and very simple as you explain evidence based research, because there's something which we think that it is something not achievable, but I think with this approach, as you said, it makes things very simpler. Well, so Dr. Juta, you mentioned about UG students, or like particularly I think undergraduate students, or undergraduation is the place where base of any higher building forms. So I think that is a very important part which we generally kind of miss out in our education system. So can a undergraduate student also perform evidence based study, or it is something like you need to have a real specialization, like you have a specialization subject in periodontics? So is it like that, or anyone, as in any student right from the undergraduate level also can perform a evidence based study? Can you tell me about it?
Yes, anybody can perform, like right from the first year, like whatever subjects you are introduced to. If you find there is something interesting and I want to know a simple microbiology, pharmacology, for example, there is a
Okay.
simple drug that is being given. And now I want to understand how this drug works. Uh,
Mm-hmm.
in second year, when the pharmacology is introduced, you will just understand how the drug works, the solubility, and
Yes.
everything about that drug. But there is no understanding of how the drug is performed, how I should take the study forward.
Hmm.
Evidence based research also helps us to understand whether we are well qualified in doing this research or not. If at all we think that we are not well qualified, we need to approach such kind of people.
Correct.
Go and meet the scientists who are working back end over there. Go and meet a pharmacologist. Try to
Hmm.
understand from your experts, like this is what I want to do. Do use that multidisciplinary approach and then
Hmm.
do a perform a study. This is a simple example. If you want to do, even if you think that, if anybody thinks that they want to do a study that is out of their scope, is what they feel, then you can bring it within your scope by involving more multidisciplinary approach. This
I think
also.
that's very interesting point that you said, and I think that brings my interest, at least inside this, because as you said that, so I think evidence based studies should be promoted more, because that gives the person direct access or insight towards what is meant by interdisciplinary research. Because ultimately, when we really want to make an impact, we have to go in collaboration. We have to, make it diversified, and bring, like as you said, multidisciplinary. So that should be the right approach when we really want to bring some translational approach towards research. I mean, it's not only in the lab, but we really want to make some changes. So I think that's a very good point. Well, in this context, I also have another question which is running in my mind while just you were telling. So Dr. Rujuta, is it like that dental, like if we're talking about dentists or any medical practitioner, for that matter, so any medical practitioner, they are more close to patients who are practicing at this point. So every day they see different kinds of patients. So is it that they are more suitable, or might be they have more data points to make up or design a research study, evidence based research study? So what do you have to say on this aspect? I mean, it was just my inquisitive mind which was running, because we were talking about UG students. So I think th- clinicians are more close to patients. So what do you think on this?
I have something to differ in this, ma'am. That clinicians, of course, I agree. They are more close to the patients. Maybe they are the ones who can help us give that evidence gap, or what is that we are
Right.
actually requiring. Maybe that
Mm-hmm.
is what they can give. But there is one more thing that we need to understand. For example, in this COVID times, or even from a decade, past decade, we see that there is antibiotic resistance that has been developing these days.
Absolutely. Mm-hmm.
This has posed a very big problem to the doctors into treating, like conventional antibiotics which they have been using. So now they are no more acting. They have to go for different kinds and different varieties.
Correct.
Now, this gives a scope for a microbiologist to understand about the bacteria, why there is resistance, what is that has changed in that bacteria. This gives scope for them to even study, different kinds of drugs. They can
Mm.
go deep into what kind of drugs are actually now effective for that bacteria which has developed resistance to this one particular
Okay.
antibiotic. So this
Mm.
is just an example that, okay, the problem is seen by a clinician, but when you have
Mm.
to solve it, you need to join hands and come together. So
Right.
the problem is stated by a dentist, a clinician probably, but you need a interdisciplinary again approach in this.
Yeah, so I think in this, like in the taking your example ahead, as you said, like the problem will be solved by the microbiology, because that person has the proper expertise or education in that matter. So like this, maybe if we want to go deep down and we want to do some more molecular study at the molecular level, say, so perhaps genomics can also come inside in this. I mean, if I have understood correctly what you were telling.
Yes, definitively, ma'am. Genomics also comes in proteomics, metabolomics, everything comes into picture when we are doing something, right from the grounds and right from the roots, because one size fits all never, it's never true. So whatever you see in a single patient, you cannot apply it to every
Yes.
patient. I think now clinicians and everybody will definitely agree to this, that different kind of approach is required.
Correct. It is more of individualized approach. Yeah. So well, I think there are. I mean, I had a lot of. I knew a lot of myths which were running around, and just talking to you in just like for a couple of minutes that we're talking, I think many things got cleared about this area. And so now one thing I want to ask you. So for in academics, like everybody has different goals to achieve, correct? Like for example, when you were a postgraduate student in your times, right? So that time your first preference will be definitely to complete your work, your thesis, and get out of that four walls and get your degree and do something. So basically you were focused more on completing your thesis work. So one thing which is running in my mind, as as you say, it has to be interdisciplinary. So when it comes to thesis work in any postgraduate level, for example, so is it good or is it worth taking up or designing a research study for a thesis work which would be evidence based, or it is not a good idea? What do you think?
It is definitely a very good idea because that stands more importance whenever even as a point of an examination point of view, your examiners come and you have done something that is beneficial to the society, that itself gives you some extra marks. I mean, just to be in a as a student's perspective, if I have to talk that
Yes, yes.
yeah. So evidence-based approach should be right from the very first day of your
Hmm,
maybe graduation, not just post graduation. If I say
hmm,
from the graduation, that should be taught to all students about this. And when it comes to thesis, you need to take some risk, try to understand what gap is. A thesis should not be that, okay, I have to do something in this 3 years and I need to get out. This should not be the attitude when we are trying to do any kind of a research.
correct,
Because it's important to understand that we have a huge responsibility when we are
correct,
doing a single study.
correct,
That is very much important to understand. And whatever we are publishing, whatever results we have, we might think that there are lakhs together studies. What if one more of my edition will be there? No, we should think that why should not my edition be a very critical and important one? Why should it
absolutely
not be a revolutionary one? So that
correct.
mindset and thought should be put in every student right from the first day, is what I feel.
Fantastic. I think I completely agree with what you say. So, Dr. Juta, what do you think? Like, you have been an academician, now you are into industry, so you are kind of, you have already become a multidisciplinary personality. So, what exactly would be your take on if I ask you that, you know, what are those real gaps which lies in the education system, or maybe where we really need to work to actually tell people, okay, if you go with this path, then you really can make impact with science, or maybe tomorrow you can become an entrepreneur, you can come up with your own product, or for the benefit of the society. So I mean, keeping the context of evidence based, obviously, because that is what we are talking about today. So what is your take on this? How do would what would be your inputs in this area?
Now we have been talking about evidence based, and I think we have been talking a lot now about doing a research or a study.
Mm,
It is very much important that evidence based research is part of evidence based practice. So now,
okay.
whoever joins a dentistry or a medical profession, they have that mentality that ultimately I'll be treating patients. I don't need this. No, this is
Mm,
not the reality. This is a part of evidence based practice. You have to put these studies into your practice. That is how you can bring about the change. So now this kind of this teaching is
mm,
has to be put in the mind of the student, from the professors, from their
mm,
guides, from
mm,
the seniors who are
mm.
working with them. So this has to be cultivated in every student while they are doing or performing this research. Whenever
Right.
they see a patient, I'll give a simple example that a patient comes, we
Hmm.
have done extraction,
Okay.
and the patient says that I have hyperacidity problem. I cannot tolerate the NSAIDs, the antibiotics that you're giving. I really
Ah.
face a lot of problem, and that is why I fear extraction. The
Hmm.
patient is ready to get the tooth extracted, but he fears the medication. So now
Correct.
what can you do? You can ask the question that I'll give you antacids. Simple
Mm-hmm.
as that. I have
Mm-hmm.
tried many antacids, but it's not working for me.
Working. Mm-hmm.
What can you do? If you go back and study research, there is something called as enteric coating. Simple. This is simple. Enteric coated drugs. If you
Okay.
go and ask this is your patient's problem, that hyperacidity, there is something solution called as enteric coating. That, that is the evidence that we can get
Ah.
gather. And then if
Mm-hmm.
you ask the expertise, like if you go ask a physician that every now and then they are giving antibiotics. So this is
Correct.
the problem that I'm facing. You can call up any physician or any doctor, ask them for
Mm.
help. Then they will tell you that there are enteric coated antacids. What it does is it just bypasses the dissolution of the dissolution of the tablet inside the stomach, acid of the stomach,
All
and it
right.
directly enters the intestine. So what happens is the effect of the antacid is enhanced. So
All right.
definitely the patient will not feel that pain. This is a simple example. This you can achieve by just evidence based, practice. This is called
I mean,
evidence based.
evidence
Yeah,
based mindset and just a phone
mindset.
call. I mean, the solution is
Yes,
just a phone call away.
phone
Yeah,
call away.
I think that's fantastic. That fantastic way you have put up, So I think there needs to be a guided path, and I
Yes,
agree with you when you talk about mindset. It is important because particularly the education system in our countries like ours. I'll talk about India. I think we are all. It's more of theory, bookish, and we do not focus on practical implementation. We study
yes,
things which have been studied by our grandfather. So
correct,
so
correct.
I'm not saying those principles will go, but I think this evidence base is nothing but we are treating or teaching ourselves more practical approach towards whatever we are seeing, right?
Yes,
If
yes,
you agree.
yes.
And
Perfectly
Ruchita,
put.
talking about like we have, we talked about clinicians, and now when you mentioned that example, which hit my mind, that like if this like in COVID, this problem is happening, that is multi-drug resistance or that antibiotic resistance is happening. So that time, if I want to solve it, I have this kind of evidence. So I have to take help of a geneticist or genomics person or say microbiologist, and then maybe we really come out with a nice result. Now
Solution.
if I just reverse the perspective,
Hmm.
like I roll the ball and I take it to the other side. For example, say I am particularly myself, I have been trained, I have a basic sciences background, right? So for example, leave apart that now I have studied dentistry. For example, I am a genetics student, okay, or a microbiology student, and I want to do some evidence based research or a study even in my thesis or maybe afterwards. So what what do you think would be my approach? How can I start designing a evidence based study from this field? So because I like contrary to a clinician or a dental or medical student, they get to see patients. So what I'm trying to say, they have more data points like this, right? So how can a life sciences student or whoever, I mean enthusiast, try, if they try to do evidence based study, then what should be the approach? How should they approach it?
Yes, there is. They can also do this kind of evidence based research. And in fact, it's not they can. Even they have to do such kind of research, is what I feel. And
Mm-hmm.
now, if for example, there is a microbiologist who is doing, who has studied about a lot many microorganisms,
Correct.
and ends up understanding that there is a particular bacteria which has got so and so features, and
Mm-hmm.
this so the about the capsule, about the phyla, pili, everything. He
Mm.
feels that this is fascinating, and I want to understand more about this bacteria. For example, Helicobacter pylori.
Okay.
Type Helicobacter pylori. Just what he can do is go to the searches like PubMed, Cochrane
Mm-hmm.
database. Like,
Okay.
what does Helicobacter pylori do to human body? This is a
Hmm.
simple question. Just formatting a proper research question is important for that person. Now, I
Hmm.
am very much excited about H. pylori and I want to do study on that. Go back, start seeing. Then you will find something that it is involved in peptic ulcer.
Right.
Before this was even, there is a very beautiful story behind this, how H. pylori got introduced. So they have won Nobel Prize for this. H. pylori
Mhm.
was just treated by antacids and giving so many other different kinds of drugs, but it was never understood that peptic ulcer was caused by H. pylori, because they thought that it cannot survive the acidic pH. So now you can see how important, yeah,
Yeah. Yeah.
how
Oh.
important the microbiology comes into picture, that how it was hidden over there, sitting there, causing all this. The scientists who thought that there were the two scientists, but they thought that no, this is, I don't think, and they, one of them actually ingested, took that H pylori and got peptic ulcer, and then he took antibiotics for that, and it was all gone. A big
Fantastic.
problem solved by that.
Amazing. So I think it's a scope of evidence-based research, and I think there needs to be a guided path, or we need to tell people about that A to B transition, like start from here and then you can reach there. So I think
Yes,
that guided path is required, which is somewhere, I think it's kind of still not in one place. Definitely,
yes,
many people are doing evidence-based research because a lot of papers we see, or lot of things, new things are also coming up, and that is just the results of extremely good evidence based research work, as
research.
I understand. So I think we need to give a guided path. What do you want to offer today for everybody, if anybody wants to understand the oral healthcare environment? And as I personally feel, and I think you believe that it is an environment, it's a area altogether, and there is no segregation between medical, dental, life science, genetics, genomics, so biomedical, so everybody is allowed inside the mouth, right? so, so uh, is there something that you want to share here today regarding this A to B transition, if you have anything to say?
I want to tell everybody that oral cavity is the part of body. It's no different. Everything is attached. That is very much important for everyone to understand. It's not that only dentists work. So
Yeah.
dentists think that what can I do? It's just 32 teeth, and medicos think that what should I do with oral cavity? Scientists think that I have to just concentrate on cell. Some would think that I have to concentrate only on device making. With this, oral cavity has been neglected by every profession. I'm telling, it is highly in need that we work on oral cavity.
Hmm.
It should not be neglected. This is something. This is the most accessible organ, if I have to say. This is most accessible. Stomach is not accessible. You
Gateway,
cannot see through your
gateway
mouth.
Yeah,
It's
it's a gateway.
gateway.
Like, as I say always, you open your mouth and you're allowing the world inside you.
World
Simple.
inside it. Simple. So right from cell, right from gene signaling, right from DNA up till drugs, drug delivery systems, devices, proteomics, metabolomics, saliva, a magic biofluid, oral cancer, breast cancer, anything can be, solved with oral cavity. So there is
Hmm.
a lot of scope in case of oral healthcare research. It is not
Correct.
just confined to oral cavity. It is, in fact, it is the most diverse area of research, if I have to say that. Anything, pick any organ of your body, it has some or the other kind of reflection on the oral cavity. But be it disease or even the state of health can be decided. It is very
Correct.
much important that we always focus on definition of what is disease. Defining the state of health is also similarly important to understand what is disease. So this starts the research area. There is a lot of scope in this. I request every student and every young mind to dive into this world and at least
Mhm.
have a taste of it. Just try it once.
Correct.
You'll be amazed once you enter it. I can guarantee you that.
Thank you, Rujuta. It was fantastic talking with you today, and I think you have broken all the ice, all the myths, all those bloopers that comes with this. Is this words evidence based? Okay, high funda. It's not for me. Like as you said, I think it's for everybody, and more people come together, and more we join hands and make it a multidisciplinary effort. I think we can really bring change in terms of disease diagnostics, prevention, or however you put it. So I think it's just matter of time that everybody understand this interdisciplinary approach, and everybody gets interested particularly into oral healthcare research, because you rightly said that you know uh, i- it's a very amazing world out, not out there but inside here. so so yeah, thank you, Rujuta. Just that I would like to ask you the last question or a request that what would be your message to young aspiring science enthusiasts uh, towards their approach of oral healthcare research, understanding oral healthcare research?
I'd like to tell everybody that don't be afraid of it. It is simple. It can be practiced on a daily basis. Just keep your mind open. Keep your mind open to different kinds of opportunities out there. What you can do with this, and please try to, don't try that taking risk is very much important. Don't be afraid, just take that risk and dive into this world. I'm sure this will blow your mind.
Thank you, Rujuta. Thank you for being here. I think we will have more conversations in future, and all the best to whatever you do. And thank you for clarifying so well about evidence-based oral healthcare research and breaking all the myths that is running. And I think what I understand, my summary or my takeaway from your insights is that anybody can do any evidence-based research. It's not a very big deal anymore. So thank you and take care, and thank you everybody who has joined us today, and for your patience, and who will be hearing this or seeing this session in a recorded version. If you have any questions later, then you can write it. We will be happy to answer, and I am sure that you will enjoy this particular video a lot, because it's something which has simplified the real thing that we really need to do, either as a clinician, as a scientist, or a science enthusiast. Thank you, Rujuta. Thank you so much.